Hi everyone, and welcome to the GI Disorders Content Review. I chose yellow here because it reminds me of jaundice, because that's what happens in liver failure. One fun fact we'll start off with is that jaundice is also called icterus, and it's because there was a yellow bird named Icterus, and they believed that staring at this bird would cure jaundice. Fun fact to start the program off. So this is the basics on viral hepatitis. This is your hepatitis A, hepatitis B, hepatitis C. Note the difference with hepatitis A, that can be transmitted from like a fecal oral route. That bowl of popcorn at the bar is a real popular way to get hepatitis A. Hepatitis B and C, on the other hand, though, is more of a body fluid blood transmission, but also can be from mother to child. As you go from a more acute issue to a chronic issue, you get scarring of the liver and cirrhosis develops. You can see on the left there, the normal liver is a very smooth organ. If you've ever seen like a stingray, it's almost like that consistency when you hold it. On the right, you have a lumpy, bumpy, scarred organ that obviously, as you can see, is not going to be as effective. Now, as liver disease progresses, you start to get what's called hepatic decompensation. And this is as your liver cannot perform the functions it needs to function within your body. So you get what's called ascites, and that's a fluid buildup in your belly. You get that jaundice or that icterus. You can see that eyeball there that's very yellowed in color. One thing to keep in mind is that in acute liver failure, when you have jaundice, you will a lot of times have right upper quadrant pain accompany it, because in acute liver disease, the liver becomes bigger. It's itis. It becomes inflamed. And as that capsule stretches, it's painful. In chronic liver failure, this will not be painful because the liver actually shrinks. That's more of a painless disease. You can also get spider angiomas. You can see third one in, second one down, those little red marks all over. Gynecomastia, the fourth one in top row, that's a male chest there. You get easy bruising, you get nail changes. You can get what's called asterixis, which is a hallmark finding in hepatic encephalopathy. So speaking of hepatic encephalopathy, what happens here is the flora within your gut release ammonia. Now that ammonia is supposed to be broken down into urea by your liver, but the cirrhotic liver can't do this, so it ultimately gets into the bloodstream and affects your brain. The brain that is suffering from hepatic encephalopathy will be altered, confused, combative. This progresses to coma, respiratory failure, and possibly death. Another of the hepatic decompensation symptoms that I mentioned before is ascites, and this is due to portal hypertension, or that backup of blood flow, because the liver's hard rock instead of a sponge. We'll talk a little bit more about that later. But fluid then, because of the hydrostatic pressure, gets pushed into the peritoneum, and as you can see, it accumulates and is quite uncomfortable for patients. The last of the decompensation factors I'm going to address is esophageal varices. Now, esophageal varices happen because of portal hypertension. Now, the liver, a cirrhotic liver, is firm and scarred and tough instead of soft and pliable like your normal liver would be. Because the liver is so tough, blood backs up because it can't freely go into it or out of it anymore. Now that blood backs up into the portal system where your esophageal vasculature is and becomes engorged, and those are varices. Now, as you can see on the left there, that's what a varix looks like when it opens up into the esophagus. Look how much blood that person is losing. People do exsanguinate from esophageal and gastric varices, and it's very important that this gets treated immediately. Moving on in the GI disorder module, We'll start off with just simple nausea and vomiting. As you can see in the medulla, there's chemoreceptor zones, and they can be affected by drugs, by being pregnant, by any number of things. And triggers here can ultimately cause you to vomit. There are medications that help with this, but this is where all of that occurs. Moving downward in the GI system is dysphagia, or difficulty with swallowing. People with dysphagia have excessive saliva, drooling. They can choke on food and drinks. They cough frequently with swallowing. This happens a lot with our neuropopulation, specifically with strokes, as you know. The biggest risk to these people is if they get an aspiration pneumonia, and that's food going into their lungs instead of down their esophagus into their stomachs. Now, this picture really gets into esophageal or gastroesophageal reflux, or more commonly known as GERD. One thing to consider is the complications involved with GERD. If GERD goes untreated, it can cause Barrett's esophagus, also can lead to esophageal cancer. People with GERD frequently present with cough, nausea, vomiting. Now, the basic pathophysiology in regard to acute stress ulcers is there's a critical illness of some sort in which the sympathetic nervous system shunts blood away from the GI system, which ultimately decreases not only blood flow, but that mucus protective layer. Now, this ultimately decreases the bicarb secretion, the GI motility, and will result in formation of stress ulcers that can later on bleed. This picture looks at inflammatory bowel disease, or Crohn's disease, versus ulcerative colitis. And in ulcerative colitis, this generally begins in the rectum and moves upwards and only involves the large intestine, whereas Crohn's can be anywhere in your GI tract from your mouth to your anus, and is characterized by intermittent watery diarrhea secondary to the inflammation of the submucosal layer of the GI tract. Irritable bowel syndrome is different from inflammatory bowel disease in that IBS is more altered motor and sensory function of the GI tract. There isn't like a mechanical stricture where you can go in, or an obstruction where you go in and target. This is just the bowel not functioning as well as it could. There could be abnormal contractions and pain. You can see some of the other symptoms above. Now, one mechanical issue that you will see in a hospital setting is a bowel obstruction. And this mostly happens with people who've had previous bowel surgeries in the past and they form scar tissue and adhesions. But you can have a twisting or a volvulus, as you can see in the upper left there. And the x-ray of the bowel can show just how horrible this and emergent this issue can be. Another bowel issue is what's called diverticulosis, and that's where you have these outpouchings of the intestine that can fill with whatever is going through there. The biggest issue with this is that they become impacted and rupture. You can go on to develop peritonitis from this, which is a life-threatening disorder. Now, we've talked about ulcerative colitis, but there can be many different kinds of colitis. We covered inflammatory, that's your inflammatory bowel disease, your diverticulitis, but there can also be infectious, like bacterial. E. coli can be a significant issue, and that can go on to affect the kidneys. You can also have viruses, fungal colitis, as well as parasitic. Vascular is when you throw a blood clot and don't get the blood flow to the intestines, and iatrogenic is because of a procedure. And lastly, we're going to talk about colon cancer. Now, the hallmark findings or symptoms of colon cancer that really kind of perks your ears is bloody stool. It could be dark. It could be bright red if it's closer to the rectum. Change in bowel habits as well can signify, like all of a sudden they're constipated, or diarrhea that's new to them, as well as anything that would indicate like an obstruction where they can't go, or they're going and they feel like they haven't completely emptied their rectum, and as well as unintended weight loss, which is typical for any cancers, which we've talked about in the past. And that concludes the content for the GI disorder module. Good luck on this part of the exam, and let me know if you have any questions.